Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're talking about a common question we get asked, which is, should you purchase one of those Psoas release tools? We're going to talk all about it. What actually helps to release that Psoas? Now, as we dive into everything, we are going to tell you our favorite tool that we use and that we recommend for clients as we go into this, and we'll even show you how to use it most effectively. Now, before we get into all of it though, please, if you haven't yet, subscribe, because we have so many more episodes like this where we answer your common questions. We want to hear feedback from you, so drop it in the comments if you have any requests on anything. And I have a ton of other movement related videos where you could just flow with me and feel so amazing within your body.
Okay, Pso Rite or Pso Wrong? We hate doing that. We hate putting out specific names of products out there. But today we're going to talk about something that has been super common. I would call it kind of a fad. It is the Psoas release tools. So specifically the ones that are super hard that people lay on and use to dig into the Psoas, because everyone's got tight hip flexors, right? So why don't we make a tool that just digs it out, that just helps release it? And so using these tools, the Pso Rite being one of the more common or popular ones, has become more popular.
Yeah, exactly. And I get a lot of questions, should I get this tool, and will it be something that is finally going to help my tight hip flexors? And in short, we recommend not getting that tool. And we're going to talk about a tool we actually recommend. We've talked about it before on the podcast. And if you're watching on YouTube as well, we'll show you how to use this tool.
Yeah. And so really, why shouldn't I use this? And some people will say like, oh, well, when I lay on it and I use it, I feel so good. Right. Or like, it feels like it opens things up. It feels like it releases that Psoas. And that may be true. Yeah. I can't tell you you're not feeling what you're feeling. So yeah. Absolutely. Like the pressure placed on a muscle, especially for an extended amount of time, that's the mechanism that these tools are working on to get our muscle spindles to release some of the input that they're putting into that muscle. So it very well might make you feel like you have more length and more space in the front of those hips.
But are we even touching on the Psoas?
Well, to me, that's not even the actual point. Like, people are saying it releases the Psoas, and I think the point is that's more indirect pressure. Mm-hmm. Like, we're not touching directly on the Psoas because there's so much over the Psoas. There's so much that we need to work through, and that's where the problem comes in more so for Jen and I, is that you're laying on this hard tool that has a hard point on it, and there is so many other things that we need to work through that could potentially be harmful, especially with sustained hard pressure.
So our iliopsoas is two muscles, okay? And
that's the primary hip flexor.
So our psoas is going to connect from our upper leg and then along the inside of your hip bone and into your low back, into your spine. So think about what that's lying along, right? That's deep. Where's your spine? Right? Where's the top part of your upper leg? It's going to wrap underneath everything that is surrounding that. So that is our organs. That is our veins and arteries. If we're going to talk in layers, first we have our transverse abdominis, which wraps back to forward, right? And so we have this huge wrapped muscle that surrounds everything. Then we have our rectus abdominis, our internal obliques, our external obliques. So we have layers of muscle then surrounding everything. Not only that, but also crucial connective tissue around the area.
Yeah, and like you mentioned, I was looking up right before we hopped on just pictures of the anatomy and the femoral veins, the femoral arteries, the femoral nerve bundles that come down and basically supply the whole front side of our legs with blood supply and nerve supply, basically running right over the top of that psoas muscle, right over the top of the psoas, and then the iliacus, like Jen mentioned, that's the other muscle that combines with the psoas to make our primary hip flexor. So that's where for us the hard, sustained, long-term pressure becomes an issue, because if you're sitting on the wrong thing, if you're sitting over a vital organ, which again, like you have to work right through all of our abdominal tissue, and which laying there is our colon, which laying there is our small intestine. So we're needing to work, maybe not small intestine, depending on, how high or low you are, but there's a lot that we need to work through. And to put pressure directly on that, right through that so hard and aggressive, it can be detrimental. And I know that you've mentioned, our friend Jill Miller has looked at different case studies where people have actually caused injury to different internal organs because of using hard tools like this. And I think the second issue that we have with a tool like this is we're not really proponents of using really aggressive hard pressure in the first place.
I mean, the whole point of having something sustained and causing this muscle feeling like it's going to release, or getting that muscle, to any muscle in the body, to cause this relaxation effect that we're searching for, is that it's more of the systemic effect from our brain into our body that's causing this parasympathetic relaxation, so that we don't have so much tension into the muscle. We're giving that muscle feedback to say that you can relax. But if we're fighting into something, if we're wincing, if we're hurting, if we're almost crying, trying to do it, we're fighting our nervous system, and we're giving a different input than the effect that we're trying to create. So harder is never better in these cases. For some nervous systems, there are people who want harder, right? They want the massage to go deeper and to go harder because they've kind of trained their nervous system into those hard pressures. And so there is like a level of variability here, but bottom line, when you're really trying to affect this relaxation, this release of the muscle, it's more about using the breath, down regulating the system, and causing that overall tension release through the body.
Again, if we're trying to just act on that mechanism, there's so many other things that don't have the risk of using such a hard tool through all of the organs and other tissues that can have a much more direct effect. We've mentioned on previous podcasts that our diaphragm has direct connections into that hip flexor area. So if we are just laying on our back with our legs extended, or laying on our back with one of our legs extended off the edge of a table or a bench, in order to let that just hang there, and then doing relaxed parasympathetic style breathing with our diaphragm, we're going to get a very similar physiologic effect in the relaxation of that psoas muscle without coming with the risk of using such hard pressure through a lot of other tissue. And you were talking about not wanting to be wincing or in pain or anything when you're using these tools. And that's exactly what I see with so many people who are using them. Yes, I feel like the marketing is getting better and telling people that they should be kind of like relaxing while they do it. But it's so hard when you have such an aggressive stimulus that I've seen people use them and they can't breathe. They're guarding. You see their shoulders coming up to their ears. And that is really doing the opposite effect. It's just putting more overall stress, more overall nervous system input into the muscles. When it comes to those muscle spindles, that's the specific fiber we're trying to address when it comes to getting a muscle to relax. They just get put more on guard. So in some cases, if someone's not using this tool right and just trying to relax and work with it, they're probably putting more tension into their system. And,
there are arguments that I've heard from clinicians where you can look at an ultrasound and a trained clinician who is doing slow, sustained pressure for long periods of time into like starting to melt kind of down into the tissue area, into the iliopsoas area. You can start to create more indirect pressure. You're still going to be over your abdominal tissue because you can't move all your abdominal tissue out of the way. But you can, because we have fascia that slides and glides and we have fluid around our entire body, we can cause some movement of things, right? So we can get organs out of the way. We can start to get tissues, important tissues kind of to move out of the way so we can get some indirect pressure directly onto, indirect pressure into that. So
still iliopsoas. Indirect because you're still going through all the abdominal layers.
Yes, you still are on top of other layers. So sure, with a trained professional, not a hard tool, with a trained professional, could we potentially be getting some pressure on there? Sure. But we also then have to look at the flip side of why am I getting so much buildup of tension in my hip flexors in the first place? Because just laying on something or having someone do sustained pressure for long periods of time to start to cause some relaxation directly into the area what is that going to do when you hop off the table or you hop off the tool and now you're back to living your life the way that you were and have no other change? Like just releasing a muscle does nothing if we're not changing our movement patterns that are actually causing us to feel that tension in the first place.
I mean, that's the point we hadn't brought up yet, is that it's really not solving the issue.
No.
Even if you do feel release right after you use one of these tools, it's not solving the underlying like root cause of why we have tightness or feel tightness in our hip flexors in the first place. We've done other episodes specifically on tight hip flexors that, we can link, whether you're listening or watching on YouTube. We'll try and link that so that you can find. We also have a free tight hip flexor guide that we've kind of broken up into a course that you should be able to get a better understanding of the complete picture of how do I address my tight hip flexors. And it's not with a tool. Even the tool that we talk about, that is our favorite tool, just using that tool is not going to long-term help you fix your tight hip flexors. It has to come from the repatterning of our movement, of how our hips work with our core, all these other things in order to long-term feel like, hey, I don't need to use a tool anymore. I don't need to do any passive techniques because my hip flexor is not feeling tight. So if you want to get our free tight hip flexor guide, we'll have that linked up in the show notes or in the description on YouTube.
Yeah, it's like a free 5-day course. You'll essentially learn some stuff, try some videos each day. Now, why I like the tool that we love, which is the Gorgeous Ball from Tune Up Fitness.
There's one right behind you.
So we love the Gorgeous Ball.
Grab that thing.
Oh, grab it. Okay.
Yeah. Can you reach it? Sorry.
Okay, so this is the Gorgeous Ball from Tune Up Fitness, and as you can see, it's a little deflated, but it's like, think of it like a small Pilates ball.
That's slightly deflated.
And you can deflate it to your preference. Like this is even more than I would probably have it. I would probably deflate it even a little bit more if I was going to use it into my psoas area. And the reality is we're using it underneath the rib cage, along the diaphragm, all the way down to our psoas area.
It essentially will lie between like your rib cage and your hip bone.
Yeah. And what you're going to do as you're lying there is you're going to try to think of taking a deep breath in, and then you contract all the abdominal muscles and everything around it, and you kind of pull away from the ball as much as you can. And then as you exhale, I want you to think of relaxing everything over. And this is going to help you to melt deeper. And that long exhale is really going to help to down-regulate the body. And then we have less guarding of the tissue that surrounds the psoas to help you melt into that area even more. And again, when we're addressing the diaphragm, we're addressing the psoas. And so we can get some amazing relaxation and release of tension. And a lot of people don't realize the tension that we have in the front of our belly that could be causing a lot of the tension that we feel in our low back, right? We want our low back to be rubbed out all the time, but we're never addressing the front of our body. So this is an amazing tool to be able to do that.
And anytime we have tension anywhere in the front, say the hip flexors, there's likely other restrictions elsewhere, whether it is in our abdominal muscles or in our rib cage or
just the fascia that lays around it.
Yes, all of the visceral fascia. And while the Gorgeous Ball is even more indirect with the pressure it's putting right on the psoas, it's helping address all of that. And it's kind of supercharging that relaxation effect that we get from focusing on the breath. And trust me, when you lay on this thing, you will feel things in your gut. And you will need to focus on keeping, your breath even and staying relaxed and focusing on those big breaths. But just like Jen brought you through that process, do that for 5 breaths in one area and then move it. Move it to the center, move it to the other side, kind of get that whole abdominal area because, like we always talk about, we're not just trying to address one muscle being the psoas. We're trying to address our systemic input and why we're feeling tense on the front side of our body. And this tool can really help us achieve that.
And because it's so soft, it's grippy. So especially if you use it without a shirt on, you're going to help to down-regulate that system. There's not going to be any damage to connective tissue or any of the tissue within the area.
You eliminate that risk.
Right. So, and that's really like, why take the risk? Right? If we already know that there's case studies where people have injured vital tissue, why take that risk? It's not worth it. And then after you get this systemic downregulation, we need to understand our movement patterns. And we've talked about this before, and this is what we go so deep into with the guide, that you can actually try different exercises on to see, okay, when I activate my core, am I just pulling from my hip flexor, or am I actually using my core together? Like a lot of times people they're so used to only using their hip flexors when it comes to core exercise. They might hear a lot of hip popping. This is why their hip flexors feel overused a lot. Or maybe they have limited hip range of motion, so it feels so tense and tight in the front of your hips. There's so many other things that we have to be looking at when it comes to our movement pattern, that just using a tool is never going to be enough.
Thanks for joining us for that quick podcast and finding out why the Pso Rite is so wrong, and why we recommend other tools to try and address hip flexor tightness, as well as just a more comprehensive, thought through process of doing it so you can have long-term change. We mentioned some things. If you want our free hip flexor tightness guide, that'll be in the description. Also check out the Gorgeous Ball, and of course, we'll see you next time on the Optimal Body Podcast.